Let's check our top stories on this Tuesday. COVID-19, of course, is no longer a public health emergency, but for some folks, the symptoms of COVID-19 just won't go away.
Our Megan Zielinski joins us live here in the studio this morning with the details on what long-term COVID is and how to know if we have it. Good morning, Megan.
Good morning. Well, Mark Tracy, I sat down with our Erie News Now contributor, epidemiologist Dr. Becky Dawson, and she told me that there's not a clear way to know what your symptoms are that you are experiencing, which is why it's important you go see that healthcare professional if you're sick. Many people experienced a lot of lingering symptoms when diagnosed with COVID-19. However, long-term COVID is not very common. The National Institute of Health defines long COVID as anything 6 months post that initial diagnosis of COVID-19.
So they're asking people, what are you experiencing 6 months after your diagnosis? And what happens is that people who participated in the study that's giving us all this new information had those symptoms at 6 months, but the majority of them had reported that their symptoms were gone by 9 months. So while that is an extremely long period of time to feel, fatigued and have brain fog or have GI issues, it does appear that by 9 months, most people are seeing kind of relief from all of those long COVID symptoms.
According to the recent study, the NIH has seen hundreds of symptoms reported with long COVID, but some of those most common symptoms include fatigue, dizziness, brain fog, and gastrointestinal discomfort.
It definitely is associated with people who have a severe illness. So people who end up in the hospital or who become really sick with COVID-19 are much more likely to have the long COVID symptoms. Same with vaccinations. So individuals who are unvaccinated are much more likely to report that brain fog, fatigue, maybe some heart palpitations post-infection than somebody who was vaccinated prior to their infection.
Well, this research being done by the National Institute of Health is still ongoing. So Dr. Dawson tells us that it's important to just manage those symptoms and practice all those safety protocols, masking, hand hygiene when sick. From the studio, Megan Zielinski, Erie News Now.